In other news today, the best health care in the world, that's a phrase being used to describe American healthcare system by a lot of people in this current healthcare debate in this country. But does everyone in the U.S. get to enjoy the same kind of best health care? Each year, HealthGrades, an independent health care rating organization, reviews the records of nearly 5,000 non-federally funded hospitals and issues a list of the top 50 hospitals in this country. And what they found is patients in the top 5% of those hospitals are at lower risk of death and more for improving quicker than they are in other hospitals. Joining us now from Denver, Colorado this morning with more on the HealthGrades study is Dr. Richard May, the Vice President of HealthGrades. Thank you for joining us, Dr. May.
Good morning.
And Louisiana does have one hospital that does fit in those rankings.
It does. It does. The study we look at is looking at really the top 5% of hospitals nationwide in terms of quality. And right there in Louisiana, you've got Ochsner, which is a remarkable medical center overall, and it made our top list this year. And
what is the criteria for this rating?
When we do our ratings every year, we look at over 40 million hospital records from all over the country. We look at every single hospital in the nation, essentially. When we look at that, we look specifically at how patients do. So when you come to the hospital, are you likely to get better, get worse? Are you likely to die during your hospitalization? Are you likely to have any serious complications? What we found is that at these top-performing hospitals, these distinguished hospitals, they basically have a 29% lower risk of death and a 9% lower risk of serious complications than other hospitals around the country.
And when we hear these people in this healthcare reform debate say that America does have the best healthcare system in the world, is that an accurate statement?
Oh, absolutely. The U.S. healthcare system, by almost any measure out there, clearly has fantastic results in general compared to the rest of the world. Now, that said, the challenge, of course, is that the way that costs are going up right now, we may have the best healthcare system available, but it may reach a point where most people can't actually afford to get the healthcare we could offer.
Is it, being the best healthcare system in the world, as you have said, is it also the most expensive healthcare system in the world?
If you look at it on a per-patient basis, it's absolutely approaching that right now. Again, we get good health care, but we pay incredible amounts for it. And I think one of the challenges is that pretty soon we'll still have sort of the best health care potentially available. But frankly, if it's not affordable to the average American, I'm not sure if it actually really helps any of us.
And there you have the main argument for the need for health care reform. And both sides of this argument do agree that we need some kind of health care reform. The big issue is, and I'm sure it frustrates doctors like you, and everybody else, is that why can't some agreement be reached to go ahead and make this dire need a possibility?
Well, that's kind of the $64 question, because clearly there's no question about the fact that those of us like me who work in the system every day, we see the fact that basically the current system is unsustainable. It's going to collapse soon if we don't do something. I think the challenge is there's just so much political fury around the whole issue right now. They can't settle on any particular really formula for working this stuff out. That's, again, one of the things we really emphasize to patients right now is that, you know, it's important right now because people are paying so much more for their health care. They really need to make sure that what they're getting is quality. Fortunately, at our website, for example, healthgrades.com, you can find lots of information about which hospitals really provide the best quality care.
And congratulations to Ochsner on this one.
Absolutely. It's a great facility.
All right. Thank you very much, Dr. May. We appreciate you taking your time out to talk to us today.
Thank you. Have a great day.
All right. Thank you. And go Saints.
Go Saints. That's right.
There you go.